In this video, I'll address 5 mistakes that you need to make sure you avoid if you're going to be enrolling in Medicare during open enrollment. So let's jump into this week's topic, and that's 5 mistakes to avoid during Medicare open enrollment. And if you're not familiar with Medicare open enrollment, once you're enrolled in Medicare Part A and B, you then will generally select a supplemental plan known as a Medicare Advantage or a Medigap plan, because Medicare doesn't cover all out-of-pocket costs, Medicare Part A and B, that is. So once you're signed up for one of these plans, or if you never signed up for one and you want to sign up for one or switch to another, then you have an option to change plans during this annual enrollment that occurs in the fall. So what is the first mistake that people make? Well, a lot of times people start looking at these options too late. And the open enrollment window is a short window that lasts from October 15th to December 7th. And if you're looking to make a change to your plan, you really will need time to research your options. And you can start researching your options now. This is September when I'm recording this. You don't have to wait till October. And talk to friends, attend webinars, attend seminars, talk to Medicare supplemental salespeople. There's a lot of options that you can use to compare plans. You can also use Medicare.gov. That's a tremendous resource to go to where you can look for plans, compare plans. And I generally refer clients to a company called Boomer Benefits, which is located in Texas, but they deal with clients, I think, in almost every state. And the person I deal with there, his name is Chris Humphreys, and you can reach him at 682-233-6117. And I'll put a link to his contact information in the show notes if you go to retirewithryan.com and find this episode. And as always, I am a true fee-only advisor. I receive no commissions or fees from any providers that I recommend on the show, just trying to connect you with people that can help. So what is mistake number 2? Well, that's assuming last year's plan is the best choice. And if you're enrolled in a Medicare Advantage plan, change is constant every year. Costs can change, providers can change, and drug coverages can change. And a prescription drug, for example, you're taking this year might not be part of the plan option next year, or the price might change significantly. So you want to go to the carrier's website that you're using, and you can check on your prescriptions and make sure they're covered. You can also go to Medicare.gov, and I believe if you create a login, your medication history should also be there, so that can be helpful in looking at that. And as I mentioned earlier, price can change. With many Medicare Advantage plans, these plans can be offered for a low initial price, sometimes even free, to get people to sign up. And then what can happen is that the following year, the price may change significantly. So you definitely want to be doing some comparisons with your Medicare Advantage plans, checking on the prescriptions, checking on the costs, and also checking on the doctors that are available, because those can change as well. Again, you can also go to Medicare.gov to check on that too. So mistake number 3 is just focusing on the monthly premium as your only deciding factor. So keeping an eye on monthly premium for supplemental Medicare coverage is definitely one way that you can control your out-of-pocket healthcare costs in retirement, but you also need to keep an eye on what your other costs might be, which I said before out-of-pocket costs, but I meant to say premium costs. You want to keep an eye on your other out-of-pocket costs, because a low premium plan, for example, with a Medicare Advantage provider might be nice as far as a low monthly premium, but if you end up needing prescriptions or going to see the doctor, you might pay a lot of money out of pocket for these services, where you could also look to have a plan that has maybe a higher premium but covers more costs out of pocket when it comes to Medicare Advantage. And if your health is good, it's often advised that early on in retirement, you can go into a Medicare Advantage plan because you'll save on premium, especially if you don't go to the doctor and you don't have a lot of prescriptions that you take. But if your health isn't as good, or you're just worried about limiting your out-of-pocket costs, you could consider going with a Medigap plan. Medigap plans are more comprehensive, but they do cost more per month than a Medicare Advantage plan. And you'll have less out-of-pocket costs, but you're going to pay more per month for premium. So for new enrollees, if you're going into Medicare or you're thinking of switching to a Medigap plan, Plan G is the most comprehensive plan that you can find. And Plan F was the most comprehensive, but I believe if you're a new enrollee enrolling after 2000, Plan F is no longer available. So again, for more on this, consider going to Medicare.gov and comparing plans. So the fourth mistake that people make is assuming average costs in their planning. And there are a lot of statistics about Medicare costs. There's a lot of statistics about healthcare costs in retirement. And you can use those averages kind of as a baseline for planning. But the closer you get, or once you're enrolled in Medicare, you really want to be specific about what the costs are that are going to be for you. And those costs are based on where you live. So Medicare is priced based off your zip code. So Medicare.gov, again, great place to go. Put in your zip code. You can compare plans to get an idea of what they might cost. And one thing to compare is Medigap. And once you've decided, if you've decided Medigap is what you want and you want to go with Plan G, you'd want to go with the lowest cost plan that's available, because with any Medigap plan, all the coverages are standardized. Medicare Advantage, that's not the case. So if you're looking for Medigap Plan G, you know that you're going to get the exact same coverage whether you go with Connecticut or you go with Mutual of Omaha, for example. So I put in my zip code, and the lowest cost I could find for Plan F was $260 a month, and the highest cost was $484 a month. So that's an extra roughly $230 a month that there's no reason you're paying this, because the plans are exactly the same. So if you didn't know that, if you're just swayed by advertisement, maybe you get an advertisement in the mail from Mutual of Omaha, and you sign up for this higher plan having no idea, you could be paying a lot more. So you really need to make sure if you're going with Medigap, you shop the plans. And with Medicare Advantage, it's a little trickier because you have to compare what the plan offers, because Medicare Advantage plans are not standardized. And the fifth mistake that people make is assuming your doctor will accept your PPO plan. So a preferred provider organization, or PPO plan, is a healthcare plan that allows members to see out-of-network doctors, usually for a higher price. And people sometimes assume that because they have a Medicare PPO, they can see any doctor that they want. However, some providers don't take out-of-network coverage, and providers can just straight up refuse to provide you service. So you want to be aware that just because you have a PPO plan doesn't mean you can see any doctor, and you want to make sure that when you're buying a Medicare Advantage plan that the doctors you want to see probably are in-network. And if you don't want to deal with that, then maybe consider going with a Medigap plan, where the plans are more comprehensive and more doctors are likely to be able to accept that plan. So one thing I want to mention, I talked earlier about switching from a Medicare Advantage to a Medigap plan. This is something that you could potentially do during open enrollment, but in many states, there are medical pre-screening questionnaires that you have to fill out, where they will ask you your height, your weight, 10 to 20 medical questions, current prescriptions, and a phone interview. And if you answer certain things negatively, like pre-existing conditions or certain prescriptions, they can deny you access to the plan. However, there are some states, like where I live in Connecticut and also New York, that make it easy, and you can switch back and forth from Medicare Advantage to Medigap without any pre-screening, but that's really in the minority. A lot of states do not allow you to do this. So keep in mind that if you're not enrolled in Medicare and you're going to be enrolling soon, and you're worried about the costs of health insurance or retirement, if you have some health issues or you've had some illness in the past, you might want to go straight into a Medigap plan, because during your initial enrollment period, which is when you initially go on Medicare, you can go right into a Medigap plan without any pre-existing conditions, rather than having to go through this pre-screening process. So I hope all this information helps to get you a little bit ahead of the curve when it comes to Medicare open enrollment. And if you can do me a favor, if you're listening, if you could go to youtube.com and you could subscribe to my YouTube channel, that'd be greatly appreciated. If you're watching, if you could click subscribe below, I'd appreciate it. And if you're listening and you go to YouTube, you can search Retire with Ryan podcast, and you can then subscribe. And if you are a subscriber and you recently subscribed or you subscribe, if you send me an email at help@retirewithryan.com, and you send me a screenshot of your subscription, I will send you a thank you gift as a bonus for subscribing. So thank you for listening. I hope you have a great week, and I look forward to talking with you next Wednesday. Take care.